Hi, my name is Janae Zugates, and the lecture that I would be doing would be a lecture on how nursing students would be providing patient education on splint care after they are discharged with a fracture and a splint application to follow up with ortho after the swelling of the injury reduces. This is important because when a patient has a fracture and they are placed in a splint, swelling is a very big risk, and then it can occur depending also on the severity of the injury. If the swelling gets too bad and the splint is applied too tight, it can lead to compartment syndrome. And if compartment syndrome is not intervened on quickly enough, worst case scenario, it can lead to amputation. But in between there, fasciotomies can also occur, which can be devastating and leave lifelong scars. So the audience that I will be teaching this to is nursing students, and this will be the education that they would be providing to the patient upon discharge from an emergency room once a splint is applied. The environment that this will be done in would be in a lecture room that would still have the ability to have a station that will have splint materials that will show the difference between fiberglass and plaster, and then also have enough room where there can be breakout sessions that occur. One of the teaching materials I will use is a PowerPoint. The PowerPoint just goes ahead and helps the instructor stay on course to make sure that all the course objectives meet all the three learning domains, and that she or he of the instructors stay on task and make sure that all the important elements of the lesson are definitely hit. Another great teaching material that I would hand out and utilize is a pocket handout that has just quick tips and tricks of how to go ahead and wrap different appendages to protect from water and weather, to keep the splint dry in different scenarios and using different types of materials. An example would be if a patient has a broken leg, using a garbage bag and tape to go ahead and make sure that the splint stays dry. Overemphasizing the importance of having that splint stay dry cannot be overexpressed to patients. That is probably besides watching for compartment syndrome, that is the next most important thing that they really need to be mindful of and be compliant with. But the pocket handout would be great for, or even a badge buddy that the nurses could have to carry with them, just to make sure that they are highlighting the very important red flags that have to be hit. But then also maybe having a patient handout that's very similar that they can go ahead and make copies of if their unit doesn't have them, that they can go ahead and hand out as well, to just make sure that, again, the patients are getting the proper education of what to monitor with the splint care, but then also just to make sure they're mindful of the splint, making sure that it stays intact so that, again, the bones stay intact and heal. Another thing that would be great is again, a station with the different materials that are used for splinting between the fiberglass and the plaster, and then just have a hands-on station so they can feel the difference and see the difference. A lot of it will have a break in the lecture and the boringness and keep the class interactive. But then a lot of times, a lot of places don't have plaster anymore, but sometimes I do know, especially with supply chain issues, they are starting to stock it again in case, again, we can't get the fiberglass. And then also in the PowerPoint, just I'm overemphasizing the very important daily care instructions, again, keeping the splint dry, making sure that while the patient is not up and moving, that when they are sitting, that is elevated above the level of the heart to reduce the swelling, to go ahead and reduce the risk of compartment syndrome, but then also to make sure that they are adequately icing the splint as well. A lot of patients think with the extra padding of the ACE bandages and the splint that the ice won't get through, but again, overemphasizing that it does is still important, because the swelling is, again, the most important part of reducing the risks of compartment syndrome. Again, I mentioned that I wanted to go ahead and do some breakout sessions. So in that breakout sessions, having a packet of case studies where in groups of 2 or 3, students will have 3 examples of case studies where they have to decipher, do they have to provide further education on how to make sure the splint stays dry, or do they have to intervene upon compartment syndrome, or do they just have to apply further education to the patient on pain management versus pain that's out of proportion, that's more related to compartment syndrome. So again, just further critical thinking beyond just the splint application. And then recording the responses in the separate groups on a board so that no responses were missed and no topics were missed, because different things will come up in classes. This will also help the teacher do a real-time evaluation, because if she's noticing in multiple classes that the same topics are coming up in the breakout sessions or in questions that are asked in class, then that's clearly not covered in the material, and it definitely should be. And that's a real-time that evaluation can happen in the classes. On the second part of the lecture, there will be a video that will really emphasize what compartment syndrome looks like, early interventions, early signs of compartment syndrome, medium signs, moderate signs of compartment syndrome, and emergent signs of compartment syndrome when you really have to intervene and get a doctor right away to perform an emergent fasciotomy. So hopefully the patient doesn't lose a limb. And then there's 2 more teaching materials I will use. Just a quick post-test form. It could be 5 to 10 questions, just that, again, highlight the very important information that is critical that the patients very understand and are passed on. So just making sure that those are on the post-test and that they pass that after the end of the lesson. And then again, that they fill out a blank evaluation form. On that evaluation form, it can highlight the 5 required questions to make sure that the objectives of the class met the content and also met the teaching materials that were used. Also on the blank evaluation form, there will be a section for the students to go ahead and have their suggestions of ways to improve, or things that are doing great, or things that are absolutely horrible that need to go immediately. So that is my example of how I would do a lecture to nursing students on how to educate patients on splint care, and then also how I would evaluate the effectiveness of the lecture, and then how I would continue to improve on the lecture, building upon each class. Thanks. Bye.